And the other thing is, I also found that, like, from what I've seen when clients come to me, is a lot of clients don't get the full type of treatment. It's really just, they just treat their neck and that's it. Whereas honestly, it's way more than that. Like, I believe to treat like a patient properly, it needs to be very holistic. And that's kind of what I want to try to create with this program, is refer when I need to, when I kind of see the flags, right? Like psychotherapy, for example, if they have like a lot of mood disturbances or psychiatric history, then for sure I would refer to like our psychotherapist. But obviously I would want them to have a consult, because we know that for it kind of to work, there needs to be that therapeutic alliance. And if they don't really bond with that therapist, then I would just give them like a bunch of other resources of different therapists around the city. So yeah. Any questions?
Before you leave, then they take you to leave.
Yeah. I mean, yeah, I'll be like I guess to start the person doing it primarily, and then we'll kind of like, obviously everybody can do it, like Jill, Danny, we can all treat that, but I'm gonna bring the program to them, right? And I'm gonna kind of organize that here through the Lakeshore location and the Etobicoke location.
Yeah. And I think Raj, which is the owner of Foundation, hopefully he's trying to get me to do a curriculum for Foundation to kind of teach everything, because I've taken a ton of courses with concussion and vestibular. I'm like certified in all of them, so kind of make sure that everyone has similar types of training, as well as obviously doing your own training on the side. But yeah, I think it's best to have like a team development rather than just each person doing their own thing.
Because some of the resources they might come here, but one of the resources might be downtown, right? So it's good if we're all like on the same page and working together, because there's a lot of different aspects to concussion management. A lot of different people need to be kind of on the same page. So that's kind of what we're trying to hopefully do. Okay, so I guess we'll get started. Okay, so you guys know me, I'm Corey. This is Tina Humayuni. Like I said, physiotherapist, concussion vestibular physiotherapist as well. We're just going to go over concussion, or the program here, a little bit about concussion. Essentially, what is concussion? You guys know, but I think for us, it's important that we tell our patients about what concussion is. We don't have to get into the nitty-gritty of like exactly, but if they have an idea of what's happening in the brain, they can understand why we're trying to do what they're doing. They can, maybe like tell them about nutrition, or things like breathing, or just all the little things that we tell them to do that will help them. They'll understand why they're doing that. And we'll talk about that. Acute concussion recovery, so things on like what we do in the early stages, what patients should be doing in the early stages, what you guys, I'm not sure the knowledge, but in terms of referrals, when to refer, kind of what things to look for, if there's like red flags with a concussion, that sort of thing. Obviously some types of concussion injuries, so like what kind of how do concussions look in your office. Obviously you guys know a lot about that, but we'll go over that a little bit. And then we'll just talk about the multidisciplinary team care that we do with Foundation Physiotherapy. As you'll see, it's very multifaceted and a lot of different components to it. And then just a little bit about assessment and management, is what we do in clinic when we're seeing a concussion patient. Okay, so number one is concussion is a mild traumatic brain injury. MTBI, obviously, we like to say it's a functional injury, not structural. The reason for that is because imaging, as you guys know, is not very effective in finding a structural change in the brain. MRI, CT, cerebral blood flow, all these tests are not really that effective. So we have to go based off of function. So how is a patient presenting? What are they not able to do? And then down the road, what are they now able to do? And these things are vital for patients getting better, because sometimes there's concussion, the brain's recovering, and they may not know that you may not have symptoms, but the brain is still undergoing some recovery. So we can't even go completely off of symptoms, because sometimes symptoms are gone, quickly, but there's still recovery happening. So we have to go to the functional. We have to say, all right, you're feeling okay, but let's check your balance. Let's check your proprioception. Let's check your vestibular function, these sorts of things. And they'd be like, yeah, I didn't realize that I can't do this or that. And that's important when they're returning to sport, returning to school, or like returning to their daily lives. They have to be able to do what they have to do. But a concussion essentially is an acceleration, deceleration of forces to the brain. So what happens is the axons and the neurons, they get stretched. Blunt trauma obviously is involved, but it doesn't have to be involved. There's just that stretching of the neural tissue. And what happens is there's a cascade of events. So we'll tell our patients about this so they understand. But when there's that trauma to the neural tissue, calcium and sodium rush into the cell. What that does is it creates like a depolarizing, a depolarization of the neurons, which that essentially is like when patients have that like dazed like feeling, we think that's what's happening, right? But what happens is because there's all these ions going into the brain tissue, there's an imbalance of charge, right? So what happens is the brain tries to counteract this with ion pumps, right? And so that you need ATP and energy to do that. So there's a huge demand on the brain after concussion for energy, right? Because it's needing to use energy to balance out the changes that are happening. But the brain isn't getting enough energy to supply that. Also, blood flow to the brain is decreased after concussion. So just the patient's not getting enough energy, but the brain is trying to do things which require energy. So there's this huge energy kind of deficit that happens. And then there's issues that come from that. So there's also glutamate gets released as well, which is an excitatory neurotransmitter, which has an impact on mitochondria. The mitochondria don't work and they're not producing energy in the cell. So there's just this great issue with energy, and the ion imbalances are also present there, which leads to inflammation of the brain, which leads to the axons not communicating, the transport system gets disrupted. So there's a lot of impairments that happen in the brain. If it's a young person, their brain is developing, that development will stop in that period of time as well. So that's an issue. So if your patients have a concussion, but they have like an inflammatory disease also, they'll be more likely to have negative effects of a concussion because inflammation is already high in their bodies. So the concussion just accelerates that. And then obviously, if it's a younger person who their brains are still developing, the myelin in the brain isn't fully developed. So concussion is obviously more detrimental to them because the transport system isn't optimal to begin with. And like I said, the development of the brain for young people also stops over that time that there's changes in the brain from concussion. It says here 70 Gs of force needed for a concussion. It's not a typo. A lot of force is needed, but whiplash is 4.5 Gs. So then with every concussion, then there is a component of whiplash because 4.5 is a lot less than 70. But it's important that we treat, like Tina and I and whoever treats concussion, we don't just treat the neck, we treat the brain as well. I think a lot of therapists just go to the neck, musculoskeletal issues, headaches, that sort of thing, and maybe stop there, but we want to treat the brain as well. We'll talk about that because it's important for recovery. It's not just the neck. Neck is important, but we need to directly treat the brain. Every concussion has a component of whiplash. Okay, so I already talked about this. So we just talked about the huge energy crisis, lack of ATP. Cerebral blood flow is compromised. Oh, I didn't talk about that. So when you have a concussion, the sympathetic nervous system gets activated and the parasympathetic nervous system gets deactivated. So what happens there is the vagus nerve is not stimulating, right? Because the PNS is decreased, which leads to a decrease of blood flow to the digestive organs and things we need to become healthy, right? So people after concussion are not absorbing their food as well. They're not getting the nutrients they need. And that's obviously important for recovery. So concussion has an impact on the gut as well. That's why collaboration with a nutritionist is important. And also things like breathing to help relax the patient so that they can, we can kind of get that parasympathetic nervous system activated a little bit so that they can, you know, their digestive system can be working properly. It's very important. All of this stuff that happens in the brain lasts about 14 days, 42 days. I think studies have shown that there's change up until that time. So there's a huge chance of, if someone's getting a second concussion in that time, it's quite detrimental. So in terms of returning to sport, which Tina will talk to, it's very important that we're very careful in sending them back not too soon. And again, sometimes they feel great, but there are changes happening in the brain that they may not be aware of. So we have to be careful, but that's where we come in. We can do all this functional testing. So that's return to sport applications and second impact syndrome. So we have to be careful in that window. Okay. Signs and symptoms of concussion. You guys know all these, pretty much. Loss of consciousness, less than 30 minutes, clutching head, seizures, slurred speech, the dazed and confused feeling, coordination, problems with balance. Mood is an issue. I find that a lot too. People are, their fuse is shorter. They're not sleeping well. So just a lot of things are contributing to an increase in irritation. So that's a big problem. So psychotherapy is important as well for that. And then obviously symptoms are headache, neck pain, which we do well, nausea, vomiting, blurred vision, balance disturbances, dizziness and vertigo. We do that really well. We'll talk about that more. And then all the other stuff listed there as well. Light and sound sensitivity is important if they're going back to work. And need a computer. So I've had patients use like a blue light glasses to help them get back to work. Sometimes it's hard to tell them not to work because they have to and they can't not use a computer screen. So we, a vision, like a doctor, like an optometrist or something can help with that. So red flags of concussion. So if you see any of these things in your clinic or like on site, if you're, seeing a concussion in person, these are things to send immediate referral, CT scan, and referral to the hospital. So sudden, severe worsening headache, seizures, repeated vomiting, weakness and or numbness in arms and legs. After concussion, tenderness in the skull or swelling, bruising around the eyes or behind the ears. So that's, I think they call that the raccoon sign, where they got like the raccoons there. And then obviously pupils not reacting to light symmetrically. Okay.
Okay, has anyone heard about Rowan Stringer? No? Have anyone heard about Rowan's Law? Yeah, okay, so Rowan Stringer is, she was a rugby athlete that unfortunately died due to multiple concussions in a week's span. She didn't tell anyone about this. And unfortunately, we know that because of second impact syndrome, if you get more than one concussion after a few days, then what happens is that there's that increase in depolarization more than there already was from the onset and can create catastrophic swelling in the brain, which obviously can be quite catastrophic in the sense that can lead to death. So because of Rowan, they created a law called the Rowan's Law. And essentially, Rowan's Law is to basically prevent second impact syndrome. Unfortunately, a lot of the NFL try to go away from this. I don't know if you've seen, but there has been like a lot of news on that, where I think every concussion physiotherapist, chiropractor is kind of appalled by it. But essentially, with Rowan's Law, there's this 3-step protocol. First step is that anyone under the age of 26, but especially under the age of 18, the coaches and the parents if they're under the age of 18, need to know about the Ontario Concussion Awareness Resources. The second one is they have to engage in behavior and activities to help with concussion prevention. And then third most important one is that they essentially need to be very, like, if someone were to have a concussion, they need to be taken from the sport. So it's a removal from play. And then also they need to engage in a return to sport protocol, which is a 6-stage protocol. I'm not too sure if you guys know what that 6-stage protocol is, but I will talk about it in this session. So return to sport, as Corey was talking about, is not based on symptom resolution. Ideally, personally, I would not want someone to be returning to play like less than 2 weeks, because there's that whole metabolic cascade. And we know that even if they're saying, hey, I feel great, but they completed the return to sport protocol, I'm still like, well, your brain doesn't feel great. So I would at least give them 2 weeks off. And that's just my preference, just because we kind of know the physiology of the brain. Baseline testing can be very helpful. Unfortunately, a lot of teams don't really do it here, but I know it's pretty common in the States. Essentially, we know that we have a lot of normative data, but unfortunately the athletes, or we're not going to compare the athletes with the normal population, because the coordination must be better, the reaction speed must be better, all of these things. So it's better to have like their baseline outcome measures so that we can see, have they returned to their baseline. If no baseline testing is available, we can use normative values. So again, it's outcome measure guided, not symptom guided. So for example, I have a high school 17-year-old athlete. He suffered a concussion. This is his second concussion now. And I noticed, despite him like completely returning to play, which I've said is fine, and so has the doctor cleared, but I've noticed that his left cervical rotation is not so great. His proprioception is absolutely awful. On the left side, his coordination is not great. If you guys know anything about hockey, you kind of have to do that left-hand turn a lot. So if he can't really see from his left side, more likely for him to get hit in that side. He's not going to play as great as he can play. He also says, when I brought this up, he's like, that's why my blind spot on my left side is not so great when I look in driving, which can be not great as well, because that can be dangerous. So that's why it's outcome measure guided. There has been a study in 2022 where the risk of musculoskeletal have increased following a concussion by 8%. So despite you, especially if you have not done any physiotherapy, for those who haven't done physiotherapy, I'm not too sure if I don't think the study includes those who have physio or haven't done physio, but in general, 8% increase in injuries. And that's because we know that concussion affects your ability to use your peripheral vision, affects your coordination, affects your reaction speed. So you can get more ankle sprains, for example, you can, get more concussions, etc. Okay, so this is the return to sport, but an athlete cannot return to sport unless they have returned to school. And that's because if your cognition is not completely healed, we know that you're not very good going back into play. So the stages over here is first in the first couple of days at least, ideally, the daily activities should not give the athletes any symptoms. There has been a recent study actually done in Toronto where within the first 2 days, if they limit the screen time, they have a better recovery versus those that did some screen time in the first couple of days, especially children. I'm pretty sure the study was done on children. Okay, so they just have to follow this. So they can be on modified duties, for example, with exams, etc. So this is what, based on the Rowan's Law, the family has to be quite familiar with this if their child is participating in any type of sports. Okay, and this is the return to sport protocol, a 6-stage protocol. A specific NFL athlete was not diagnosed with a concussion. I don't know, what's his name? There you go. And essentially I don't know if you guys ever heard of him, but he kind of it was clear that he hit his head on the ground, but then he came up and he started walking all days. And the doctor, I'm sure the doctor knew he had a concussion, but because it was a really important game, they basically said it was a back injury. We all know with back injuries, do we kind of do this or do we stiffen up our bodies, right? It doesn't really make much sense. So he went back to sport, and then when he came back to sport, hit his head again a few days later, and he started getting some clawing. I don't know if you guys know what clawing is. It's like tonic posturing. And essentially what that means is that more of a severe brain injury because it affects the brainstem. If you guys have ever heard of the clawing, tonic posturing, yeah. So it's quite serious. They say he's fine. Honestly, I'm not sure how much I believe in that because of what I've seen, but obviously he's not playing right now. So essentially, as you can see here, you start with the symptom limit activity, you work your way up all the way to full contact practice. In order for them to return to sport, it says a healthcare professional needs to return to sport, but I believe in Ontario, a doctor needs to return. So usually a sports medicine doctor would do all the examination, but you guys could also pretty much return them to sport as well.
Is this from the Pacific? I think that often, but like there is you.
Yeah, so
Have like the 6 stage.
yeah. It's very similar. This is just based on the SCAT-5.
Oh, yeah.
Yeah. Okay, so early self-controlled aerobic exercise is super important. If I see a client with a concussion and they're coming into my clinic the first week, if they're coming as early as the second day, I'm getting them on the treadmill because there's so many studies to show that early aerobic exercise has reduced recovery rates, or sorry, improved recovery rates, reduced the delay and return to sport and school and everything. If you guys know about Dr. John Letty, he's pretty popular in the concussion field, and he is the one that developed the Buffalo Concussion Treadmill Test. So that's exactly what I would use, the Buffalo Concussion Treadmill Test. If you guys know what that test is? No? So essentially the Buffalo Concussion Treadmill Test is a treadmill test where the patient will go on the treadmill. We start them at a certain speed, and then every minute increase the incline at a specific speed. And I'm going to measure the heart rate, their symptoms compared to their baseline. So they tell me what their baseline is, and then every minute check their symptoms and also their RPE, so rate of perceived exertion. And then I say, when has their symptoms increased 3 or more from their baseline? Obviously, RPE is important. If they're like huffing and puffing at a level 4 and they're a college athlete, like I'm still thinking that there's something going on with their heart rate variability, even though their symptoms may not increase. Right, so these are all things that I will take into account. And after I get that threshold, I will create an exercise prescription. They work at this exercise prescription every single day for 20 minutes. And this is honestly the best way to help with autonomic nervous system dysfunction, which is why I get every single one of my clients that have a concussion to do this test. So this is a really great study. This is done by Dr. David Lawrence. Actually, Dr. David Lawrence is the one that I actually refer to at McIntosh Sports Medicine Clinic. And it's really shown that earlier times aerobic exercise associated with faster recovery following acute sport concussion. So this is in athletes. As you can see here, sorry, do you mind moving that thing?
Sorry. I was just making sure not.
Okay, as you can see here, initiating aerobic exercise at 3 and 7 days following injury was associated with respective 36.5% and 73.2% reduced probability of faster full return to sport. So for an athlete, it's really important. For anyone, it can be really important because they want to get back to their quality of life, right? So as early as the second day, I would get them on doing this test.
Sorry, is that saying if you wait 7 days, then there's less likely to do faster, they're less likely to return to sport?
So the ones that they did the Buffalo Concussion Treadmill Test at day 3 versus day 7. So day 3 was 36.5% reduced probability of faster return, and day 7 is 73. So that's basically double.
Oh, I see.
Yeah. Does that make sense?
Like a lot of negatives.
I know. It could have been worded better, but I basically just copied and pasted what it said in the abstract. Okay, so acute concussion recovery. So there's a massive role for physiotherapists early on. The faster they can come and see us, the faster their return to sport is, especially for athletes. However, I don't really start vestibular rehab until a month later because a lot of things can resolve on its own. But there are certain indicators where I'll start it earlier if there is a predictive factor of them having delayed recovery. One of them is if they have dizziness right away when they hit their head, then it's considered a delayed recovery. If they get a concussion in the luteal phase of their cycle, I do ask about that. Delayed recovery. If they have ADHD, I do ask about that. And there's also some specific factors for children, and I will talk about that in another study, that can also cause delayed recovery. And these are things that we need to look out for so that these people get treatment early on. A lot of metabolic support during the acute phase can be helpful in preventing persistent symptoms. We know that cascade of events that Corey talked about. There's that excitotoxicity in the brain, there's that neuroinflammation in the brain, there's that energy depletion. So what are the supplements that we can do to help with this? One of them being omega-3s. Omega-3s, you probably know, like the most basic one that everyone prescribes. It helps with membrane support. Usually it's a very high dosage. I really can't prescribe that because it's not my scope, so that's when I would refer on. But magnesium, omega-3 and magnesium is really helpful for cognition. A specific dosage though is usually a higher dose, not just a lower. Creatine is really helpful for ATP depletion. N-acetylcysteine, there's been a study that showed that taking N-acetylcysteine within the first 24 hours has shown a significant decrease in delayed of recovery. Curcumin, which is important for inflammation, exogenous ketones, they have shown that like in concussion, the brain tends to sometimes uses ketones as their energy. So maybe supplementing exogenous ketones can be helpful, as well as alpha GPC, which is important for cognition. It's not necessary to kind of prescribe all of this, but these are just some things that, depending on what the patient presents with, they have brain fog, cognition issues, they're very tired. These are some things that they may be prescribed in, and acutely it's very important because we know within like 45 days is when that whole concussion, cascade of events happens. Absolutely avoiding gluten and dairy as much as possible because they're very neuroinflammatory. So the brain is leaky, the blood-brain barrier is leaky as a result of the concussion, as well as the gut is also leaky. So anything that we eat can impact the inflammation that you get in the brain. And I've also known with my clients, they, the ones that have PCS, they go, I don't know, they ate a lot of sweets, had wine during Christmas. Then they tell me, Tina, I had the worst headache of my life. Every single one of them that did that. And it's because they ate a lot of sugary stuff and it's a lot of processed food and they get more inflammation. And then the second they stop, they say, wow, I actually feel much better. Alcohol is an absolute no. There hasn't been really that many studies that have supported this, but we know what alcohol does to the body, especially the coordination. And also from experience, I've drank alcohol with a concussion, and let me tell you, the hangover is like a week long, so don't do it. And it can also delay the return. So symptom threshold aerobic exercise help with blood flow regulation, cerebral blood flow. We know that doing that, stay in a dark room until your symptoms go away is not really helpful. Why is that not helpful? Because when we're sleeping, we already have the vasoconstriction that's happening in the brain. So if there's no cerebral blood flow occurring in the brain, that there actually can lead to delayed recovery. And there has been a study showing this year as well. If you guys ever want to know all of these articles, just let me know. Stress management is super, super important. So the baseline thing that I do with acute concussion recovery is targeting their sympathetic dominance. Because if they have a very high sympathetic nervous system, what is that going to affect? Pupil dilation. So it's going to affect their ability to constrict their pupils, which we know can create light sensitivity. It can affect their sleep. Maybe they're not, especially those people who say, I can't sleep properly, I wake up all the time, very much likely they have a high sympathetic dominance. It can affect their GI system. So maybe, they're having GI issues, diarrhea, constipation, all of these things. If I just stress with diaphragmatic breathing, surface orientation, mindfulness meditation, yoga, anything that would do to reduce that sympathetic dominance can be very helpful. And then obviously gradual return to activity. So first 2 days, minimize screens as much as possible. They can go for light walks though, and that can actually be very helpful, especially in the morning, because in the morning we want that blue light actually, so it helps with circadian rhythm, but near like the end of the day is when we want to remove the blue light from our vision. But blue light's obviously helpful for computer screens, but blue light is not the only thing that can be helpful. There can be pink light glasses, different tints depending on what the patient kind of needs, and that's where if they're having a lot of screen time issues for a long period of time, I refer to a neurooptometrist to kind of give them what they need. And usually the gradual return to activity includes if something increases their symptoms past 3 or more, then I say you need to kind of remove yourself from that activity, do your physio exercises, do what mindfulness, anything to bring that symptom back down to baseline and then continue. So that's how we do it now. And if symptoms persist more than 2 weeks, it's no longer due to the concussion. We know it takes like that window of vulnerability is that 2-week period for that metabolic cascade. It can go up to 45 days, but we know the most amount happens in the 2 weeks. So if it persists more than 2 weeks, we think maybe it's the neck that's dysfunctional, we have to address it. Maybe it's their vestibular system, we have to address it. Maybe it's their vision, maybe it's their autonomic nervous system. It's really anything. We're going to determine it based on the assessment. Okay, so early intervention and concussion. This study was a prospective observational study. It was contains a cohort of 991 patients that were looked over between 2014 to 2018, and this was done in a level 1 trauma center in an urban area, I believe, in UK. And the participants with a concussion, obviously there was inclusion criteria, so it's not a more moderate or severe brain injury, had a 73% incomplete recovery at 2 weeks and 56% at 6 months. I don't know if you guys heard, but you probably heard that 10 to 30% of patients develop PCS. That is quite incorrect. Honestly, I see it myself. A lot of people don't actually fully recover. They just compensate a lot. So that's why I'm saying if they return to or they start physiotherapy earlier on when they have symptoms, especially past the 2 week mark, we can help them return to full quality of life versus not doing so. And I know a lot of clients that I tell them I'm a concussion specialist, they're like, hey, I had a concussion like many years ago, like I feel fine, but man, my neck is killing me. And that kind of persists like for the rest of their life unless you get that treated, because neck pain cannot just be neck pain. Neck pain could be because the oculomotor system is not working enough. Neck pain could be because the vestibular function is not giving enough feedback, and people can get persistent neck pain. So that's where like I have these infrared goggles. It kind of takes a look at how the eyes move without fixation, which is without light, and it gives me quite a bit of an idea of what's happening with the oculomotor system as well as just the brain in general. Okay, so this is the study I was talking about, children that sustain a concussion presenting 14 days after injury and still have signs and symptoms are considered high risk for post-concussion syndrome. So something for you guys to kind of look out for. So early intervention is helpful. These physicians use a Buffalo concussion physical examination to determine risk for delayed recovery for children in post-concussion. So these are the things they kind of look at. Orthostatic intolerance can actually happen quite frequently. I've seen in my own population. So people who say, I kind of go from sitting to standing and I get like that lightheadedness. I see it actually a lot in the clinic. Horizontal repetitive saccades, so that jump eye movements, vertical saccades, vestibular ocular reflex. If you guys know what the VOR? Yeah, so like gaze stability, near point convergence, tandem gaze, neck tenderness, neck muscle spasm, neck range of motion. These are things that we're going to look out for. So there are subtypes of concussion. Oh, no problem. So there are subtypes of concussion. I like to use Hayter et al.'s version, but there's honestly many different types in the literature. There's the oculomotor, vestibular, there's the cervicogenic, there's the autonomic nervous system, there's inflammatory, and then there's the anxiety and mood. So inflammatory could be maybe they have brain fog, for example, or fatigue, and autonomic nervous system dysregulation can honestly be even like stress. They have a lot of stress, they have a lot of pupil light sensitivity, etc. So these are common presentations in concussion patients. I won't go into the nitty gritty, but essentially it can be very, very complex. They can have vision disturbances and double vision, blurry vision, nausea, and vomiting quite often, and that's usually from the brainstem. We know that brainstem is often implicated in concussion. Headaches, a lot of people have post-traumatic migraines, which their migraines are different than regular migraines, so they need to be treated differently. Difficulty exercising, they have that heart rate variability, sleep impairments, hyperarousal. Every single concussion patient will have hyperarousal. It is just part of the system. Mood changes, if they're getting a lot of symptoms, they're not going to want to see their friends, because then they're going to, get symptoms by talking to people, for example, or being in a very busy environment that makes them more isolated. So it's that cyclic effect, unfortunately, that needs to be addressed. And then cervical and TMJ impairments, vestibular symptoms, cognitive delays, etc. Gender differences in concussion. There is actually a lot of studies to support this. So females are more likely than male counterparts in certain sports studied to sustain concussions in the same sport, as well as females more likely than male counterparts in similar sports sustain a concussion despite not being able to do intentional body checking. So even though they're not getting body checked, for example, rugby or football, they're still getting more concussions than their male counterparts. And that's because you don't necessarily need to even hit your head to get a concussion. You can just have that significant acceleration, deceleration of the brain, which may look like a whiplash to some, for them to get a concussion. So it's important to know how fast that person is coming to hit you. There's like many elements to know the biomechanics of, whether they get a concussion or not. Females are more likely to have longer concussion recovery times, get a greater decline in simple and complex reaction time, cognitive impairments, and etc. And we think maybe because females have more hypermobility in their necks, especially, so less strength in their necks, maybe some hormonal differences. So there have been studies to show that females that get a concussion in the luteal phase are more likely to experience a delayed recovery, and that's because luteal phase, there's that drop in progesterone. Progesterone is a neuroprotective factor, so that can result in a delayed recovery. So concussion rehab should be multidisciplinary. I want to just kind of go over this quick. We already talked about this, so we have kind of a whole team at Foundation Physiotherapy to kind of help with this. Occupational therapy specifically, only if I find that I can't get them back into their activities, then I would refer.
All right. And so with an assessment for a concussion, obviously we're going to do a musculoskeletal exam. Looking at the neck, the TMJ, sometimes there's contact to the jaw, ribs, thoracic spine. When we're dealing with MSK issues, neck pain from concussion, if their thoracic spine isn't moving well or stiff, then the neck might take more of the brunt and use more. So you have to adjust thoracic spine. Breathing is important, again, to stimulate the parasympathetic nervous system, to calm them down because of the concussion that is depressed. So we want to help them with their breathing, but also seeing how their rib cage is moving with breathing to see if there's a restriction there. If they're not getting proper breathing, then it's going to affect their ability to take in oxygen and whatnot. A neurological exam is important, obviously. Cranial nerve exam. We all do that. We could do that. If there is an issue with cranial nerves, then we might be thinking of referring out or sending for imaging if need be. Some of the aspects of the cranial nerve exam we can kind of help with. Some of the stuff, obviously, like if there's a vestibular issue, we can help with that. But a lot of it is some of it is beyond our scope. You would want to refer out or send for imaging. Vestibular and visual assessment is again important. We do that almost not always, but we do it definitely is very, very important depending on whether they need to get better in that aspect. Gait assessment's important. Obviously with concussion, they lose balance, lose ability to walk properly, and that can lead to obviously further falls or further injuries in the future and more second impact syndrome as well. Especially if they're returning to sport, they need to be functioning and walking and doing all that. That comes with the balance as well. So these are all things we can help with, and that's what we do. We do when we're treating patients in clinic. We help with all of that. So this is concussion treatment is multifactorial, as we have said. Education is important, especially in the early aspects. Again, them knowing what the issue is and why it's happening, they will buy into what we're telling them because they will understand why we're saying not to do this, not to do that, what to avoid. If they know, for example, like your energy is being depleted, so make sure you're eating well and make sure you're breathing and like all these sorts of things, right? So mindfulness, relaxation, important. Psychotherapy, support if necessary. We have those you guys have those resources. We have those resources within Foundation Physiotherapy as well. So obviously we know who to send for that. Nutritional support we talked about. We obviously work on the neck. There's a lot of neck pain, headaches, that sort of thing. We do that obviously with treatment. And then vestibular rehab, we talked about that. We talked about vision rehabilitation. So that's important, especially if they're having issues with screen time. Again, we don't recommend screen time in the first 48 hours, but after that, if they have to get back to work and it's still an issue, then we have to use the goggles or whatever, that sort of thing. But we work with the patient to kind of figure out what works for them to get them gradually back into work or into a sport situation. Cranial drainage, that's, more, I don't know if
That's
you
something
do.
I do actually.
Yeah, I don't,
I learned it in my course. It's actually super, super helpful. I'll give you a story, which honestly, I still don't understand how this worked. I had a client that came into my clinic and it seemed like she was getting a bit worse. In terms of she had like some more like she already had speech issues and she had a CT scan already before. It seems like she was getting more speech issues. So I said, okay, obviously I referred her to get a CT scan and it was clear. She came back to my clinic and then I did some drainage on her and her, like during that session, her speech dysarthria like just went away. Like I am still like appalled, like I was surprised by it, but it honestly, she was like, my speech is better. She started speaking properly. It was weird. Obviously, if you have speech dysarthria, that's kind of like a red flag. You need to get that checked out. But otherwise, it was really cool.
cool.
Yeah, that's what I do.
And then neck and thoracic mobility. I want to just like, I want to highlight the importance of neck strength, deep neck flexor strength, so the ability to keep the head back. It's important for like concussion, right? If the person's like got like a forward head posture and those deep neck flexors are weak, it's gonna put a strain on the suboccipital muscles when they're looking up. Because they're kind of extending while slouching forward. So we want to work on deep neck flexor strength. And typically it's weak in everybody. And we see patients and we test them all the time and nobody can hold it the amount that they should be. But it's definitely more of a important, even more important when someone has a concussion because they're having headaches. And it says here that neck extension endurance is typically stronger than flexion. Which is obvious because we all sit too much and we're all slouching and not doing what we should. So deep neck flexor strength is super important. And yeah, we do work on COC2 because that's kind of most compromised with head trauma. I guess that takes, when you get a concussion, that those joints take the brunt of a lot of the force from the collision. So it's just upper back, neck, super important to go along with the brain, the treatment we do for the brain as well. Yeah, and then I guess at the end, when patients returning to sport, we kind of combine all the different aspects together. So visual, vestibular, and cervical, and a goal-oriented task. So we'll get them to mimic like what they're doing in their sport, and we'll like perturb them or cause issues, cause like, challenges to those systems. And if they can do the task and are great with it, then we're more comfortable telling them they can go back to their sport. And then we try to make it sport specific because obviously like every sport's different, it has different needs and tasks and abilities. So that's usually kind of what we're working towards in the late stage of concussion rehab. So yeah, we do all of that. So in summary, it's blocking there, but physios, chiros, we have obviously we have a vital role in the rehab process, and we know who to refer to. You guys do as well, but if you have any questions, just let us know. We all have resources we can use to help us because we all have different expertise and all that. So, but in the beginning, in the early stages, rehab is very important just because of what's happening in the brain, and we do what we can when we can. As soon as possible, avoiding light until your symptoms resolve, and just the resting that's not recommended anymore. We want to do, maybe after 24 hours, maybe 48, depending. We want to get them doing some stuff again, like aerobic exercise and definitely rehab, and we can help them with that. Again, obviously need to treat all components of concussion together, not separately. And treating early on. It's not too late to treat post-concussion symptoms. Tina was saying that she had, she thinks, someone had neck pain like years after their concussion. So these things do linger. The later, the worse, but the later it takes to start things, the harder it's to get better, but it's never too late. Like we can help people even, years down the road. Yeah, that's that. And I think we're good. Any questions from you guys?
Yes. One question.
Yeah.
Yeah, you were talking about like the parents who were a little bit activity early. Usually, thank you, but I guess even like the mid, treadmill test, for us, obviously, we're not doing that.
Yeah.
Like, yeah, my go-to has been, the 48 hours in jail. And
Yeah.
would you say like 48 hours in jail, except, go for a walk? Or
Yeah, no, so I would do 48 hours, like, and they still should be walking. For sure, because we need that cerebral perfusion, that's, we get that vasoconstriction in the brain, which we want to kind of help as much as possible. I usually wouldn't do the Buffalo concussion treadmill test until after day 2, just because like they're probably very symptomatic, they have a lot of headaches. If I'm trying to, do the test based on their baseline, if they have a 7 out of 10 headache, they're gonna go to a 10. I don't want to get them there. You know what I mean? So I do it just, I know the study is based on athletes. So if the parents like this person needs to go back, I say, okay, let's do this right away. On average, I'd probably do it if it's acute within the first week. Yeah.
You find now, maybe not switch now, but is a lot of your concussion patients usually a sport with you, or just like people who are very advanced and you just need to return to the level of kind of like for us. We obviously we see patients in person, but there's so much on the EMR and all that is really for them.
I'll give an example. So I actually suffered a concussion in March, unfortunately. I had really badly in snowboarding, and I am like, my schedule is usually like quite full. And the first week where I thought I would push through my symptoms, I had the worst headache of my life. Every single day I had a 10 out of 10, completely delayed my recovery. That is not what we recommend. You can take some time off, maybe that's helpful if you have the benefits. Unfortunately, in my type of field, I don't get paid if I don't work, and so I kind of pushed myself. However, the following week, what I did is I did a break every 2 hours when I thought that was my max. And what I did in that half-hour break was I meditated, I did my neck exercises, did my neck mobility, and I did a lot of deep breathing. And that helped tremendously in my symptoms. I mean, my second week was way better than my first. And I have a lot of clients who work desk jobs, right? So what I say is, if your symptoms increase by 3 or more, get out of the screen and just do something. It may take you longer for you to do that work, but if you don't do this now, it's gonna take months for you to recover rather than maybe even like a few weeks. So it's something, that education piece is so important. Like, I really make sure that my clients know, what is a concussion? Why are we doing certain things? Why is it important for you to get your nutritional demands? And some people will drink on a concussion because they want their life to get better. And I say, well, how did you feel? Like, I had a hangover for 1 week, and like, yeah, also you also delayed your rehab. So now something that you wanted to do in 2 months, you can't, it's gonna be 3 months. So I'm not trying to scare them, but I do try to tell them the cold, honest truth that they really need to take care of their brain, because unfortunately a concussion is a mild traumatic brain injury, right? Like, it's a brain injury, it's not just a neck injury. So there's been studies to show that multiple concussions can lead to dementia earlier on, right? So things, you need to take care of them, they need to have the education, all that kind of stuff. I know it sucks to not make that much money in the interim, but if they don't do that, if they don't do something like they don't gradually return to sport or school or work, then they're gonna, feel the repercussions of it.
Yeah, one of my classmates in med school, she missed the whole, she had to skip a whole year of med school.
Yeah.
because of-
It's pretty
It
awesome.
was like her third one, she, like, was at a restaurant, stood up and hit her head on like a jump,
Oh,
a whole year.
Yeah, it's not nice. And women do tend to get like the worst outcomes, unfortunately. I see like most of my clients are women. I have maybe one male client, but most of them are females, unfortunately. Every female, I'm working on their neck, but mostly massage, because I find that, because I do myotherapy, I do mobilization, you probably do adjustments. I don't do adjustments, but because you're so hypermobile, me really doing the joint mobilization is going to make them feel worse. So instead, I do a lot of strengthening for those patients. I will work on the massage, because if you have high tone, you can't utilize that muscle. So it's important to kind of reduce the facilitation, maybe do some acupuncture, because acupuncture can help with that parasympathetic drive that we said was kind of low sometimes, but not always our parasympathetic drive low. they can have a high sympathetic drive with a parasympathetic maybe normal.
Mm.
Right, so it's kind of looking like I use a screening tool and I give them like a form and I say, and it asks about sympathetic and parasympathetic information. And I get that and I'm like, okay, well, this is what you need to do to reduce your sympathetic drive, or this is what you need to do to increase your parasympathetic drive. And there's different techniques that we kind of use to help facilitate that, which is why it's very holistic. It's not just like me just treating your neck and stuff like that. Unfortunately, a lot of Toronto's not like that though. That's why I have clients that have concussions for 3 years down the line that have been treated from the start that are still getting symptoms, and now they're finally starting to get better because I treated them as a whole rather than just treating their neck.
Treating the neck is, for us, it's the easy part, right? Like the hard part is the other stuff, right? So someone who's trained should be able to do that and should have the skills to do that. That's what we're trying to do here and at the other clinics as well, so.
Any other questions?
Okay.
Yeah, perfect.
Thank you.
Pretty good?
Yeah.
Okay,
Anna,
thanks for listening. I really
Thank you.
appreciate that you guys took out time from your busy schedules. I know you guys are probably extremely busy, but honestly, I really, really do appreciate that you came here and listened to us, because I'm like, we're super passionate about this. I'm extremely passionate about concussion. I got like 3 concussions in my life. I know the repercussions of it, how much of an impact it made to my life. So I want to make sure that people get kind of the care that they need early on, so you know they can have a good quality of life.
One of my daughter's friend's mom, she's like, I could probably lawyer, she's an awkward.
Yeah, that's
Mhm.
Doing, I was in a patient, I don't follow it, but doing, you know,
Yeah.
everything is just whatever, email or back to work is screens. So
Mhm.
and reading and, you know.
Well, it's probably a very type A personality, so there's probably that like component of psychosocial, because now they can't do what they normally can do and they have to step back, and that can be very, very hard for people that usually are super busy all the time. Right, so that's also a big component as well, and yeah.
I think you said like certain jobs, like you need to work to make
Mhm.
money and then there's parents. like,
Yeah.
you can't
Mhm.
check yourself.
Yeah,
So that.
Mhm.
that's
That's true.
Really brutal.
that's it's
And a concussion, we don't, we need to take care of ourselves.
yeah.
Yeah.
Concussion is awful all around.
Thanks for presenting guys, and the opportunities like that and.
Yeah. We're recording this, so we can send the link. We'll put on, actually, I think we're gonna put on our website, and so it's easy to find for the ones who couldn't make it.
Also, we have I guess a slide deck there. Is a slide deck or just?
It's just a
separate-
handout. It's
handout.
a,
You guys
yeah.
can take one.
it was hard to
Those are useful.
put everything on there.
Find yourself,
Yeah.
I'll post it on our as well.
All right, cool.
And if you have any, have any questions, like even not just because of the presentation, but overall, if you think you have a patient that might benefit from chiro or physio, obviously there's like our cards that are on the sheets, but you can also probably find us on the website, you know, give us an email.
Whether it's any place or.
So obviously he's from
Yeah.
Etobicoke.
So cool.
I'm at City Place, at front of Spadina, yeah.
Okay, thanks, guys. Stop share, yes.
January 31st, I thought it was a long.